Today, our discussion will be on acute appendicitis. Appendix is a tubular structure that attached with one end of cecum. For its worm-like appearance, it is known as vermiform appendix. Appendicitis means inflammation of appendix. Inflammation of appendix may be due to obstructive causes. Ficholith is the most common cause of obstruction. Other causes are foreign body, ascaris, phlebolith, carcinoid tumor. Appendicitis may be due to catarrhal cause, which is common in children. Whatever may be the cause, once the lumen get obstructed, there is accumulation of the secretions within the lumen, which gives pressure on the wall of the lumen and causes pain. Gut flora may start multiplying and activate the immune system of the body, resulting in leukocytosis. If the obstruction persists, the amount of secretions increases in the lumen and the tube continues to swell up and it compresses the blood vessels in the wall, which results in decreased oxygen supply, becomes ischemic, and perforation occurs. The clinical features of acute appendicitis, like symptoms, sign, lab findings, all of them are aggregated in a score known as Mantrell's scoring system. You can remember this as Mantrell's. This is a mnemonic. M for migrating pain to right iliac fossa. A for anorexia. N for nausea vomiting. T stands for tenderness, which is maximum at McBurney's point. McBurney's point is defined as a point that lies one-third of the distance laterally on a line drawn from umbilicus to the right anterior superior iliac spine. It lies at the junction of medial two-third and lateral one-third. R for rebound pain. It occurs as a result of peritonitis. When perforation occurs, bacteria's release in abdomen cause peritonitis. E for elevated temperature. L for leukocytosis. And S for shift of WBC count to left. Here, one thing I want you to remember, all the criterias are given a score of 1 except 2, the tenderness and leukocytosis, which are given a score of 2. Total score is 10. Now, out of these, the first 3 things are symptoms, the next 3 things are signs, and the last 2 things, that is leukocytosis and shift of WBC count to left, are lab finding. Now, if someone has score 1 to 4, it is very unlikely to be appendicitis. We discharge the patient. If the score is 5 to 6, we keep the patient under observation. If the score is 7 to 10, sorry, it would be 10, not 8, then surgery is done. There are certain signs which are important for acute appendicitis. Rovsing sign: if I give pressure on left iliac fossa, pain is felt at right iliac fossa. Then psoas sign: hyperextension of right hip and flexion of right hip against resistance causes pain in right iliac fossa. Flexion of right hip against resistance causes pain in right iliac fossa. Next is obturator sign. Here, flexion and internal rotation causes pain. Now, coming to the investigation. Investigation of choice for adult is CECT. Investigation of choice for children is USG abdomen. Management is appendicectomy.